I was from the days when the doctor spoke and the nurse replied and did what the doctor spoke.
I came as quickly as I could.
All right, going quietly.
And so when I heard that nurses could be something more, I went to the meetings to see what was going on and became a nurse practitioner. I discovered I was illegal during that time, but 20 years later, we nurse practitioners were legal.
First had nurse practitioners here in the early 70s. If we look up in Northern Ontario, Northern Canada, we had them even before then. It took until the early 90s before we had a health minister who announced the full integration of the role.
There were educational programs in the early 70s in universities to help prepare nurse practitioners.
And then in 1983, they stopped the last program in Ontario. So at that time, there were about less than 200 of us trying to maintain an identity.
And so the nurse practitioners who had been trained continued to work in community health centres or in underserviced areas, but there was no education and no more nurse practitioners being trained.
So I would say from the next 10 years, from 1983 to 1993, it was basically this small group who were holding on by our fingernails. I became chair of the Nurse Practitioner Association in March of 1990, and so we started to work on the standards of practice. We got some guidelines on how to write standards, we got permission from the College of Nurses, and then it was in 1993 when Ruth Greer became Minister of Health that things really started to move very, very quickly.
My knowledge and personal experience with nurse practitioners was, I think, very helpful in making me an advocate for moving on a number of different fronts to make sure that their role was recognized and solidified.
Greer says she believes the system will save money and improve preventive health care.
Rather, they begin from a prevention and health promotion focus. They start by giving their patients the information, the care, the advice, and support they need to be healthier and to avoid or prevent illness.
I think one of the critical pieces in our history is actually the support that we have had from many different politicians.
My key contribution as the president of the Nurse Practitioners Association was securing additional funding to be able to follow through with Bill 179 to make a difference in care through admission and discharge at hospitals or full enablement and empowerment of nurse practitioners wherever your practice may be.
The legislative and regulatory changes that have taken place in Ontario have made dramatic impacts on patient care already. We have nurse practitioners being able to discharge patients from hospital to provide care throughout their hospital stay, and we're getting to the point now where nurse practitioners are able to admit patients to hospital as well. So it's really improved access as well as the quality and continuity of care.
We supported nurse practitioners because we believe that they provide a very important role in improving access to health care throughout the province of Ontario, no matter where it is. And, you know, nurse practitioners are everywhere today.
Bill 179 really is, in a certain sense, the engine behind progress since we got the ball rolling with that first clinic in Sudbury.
I was involved in the setup of this first nurse practitioner-led clinic in Canada. There are really some key moments that I remember as seminal to nurse practitioner practice in Ontario. And one, of course, is the nurse practitioner-led clinics. The expansion of NPLCs across the province has really put nurse practitioners on the map.
We love our nurse practitioner.
The whole family comes to this clinic. Our two adult daughters, Edda's mother's just moved up to Sudbury and she's about to become a patient here.
The vividest milestone was on opening day, coming down the street around the corner and seeing people lined up outside the clinic building waiting to come in and register for the clinic.
That's right, Colleen. The role has been in North America now for more than 30 years.
The Nurse Practitioner Association of Ontario has been absolutely essential, a critical force in establishing and entrenching the nurse practitioner role in the province. We see nurse practitioners doing wonderful work here at Sick Kids.
We have very complex patients here that we look after in the NICU. We have several patients that require surgery soon after birth.
Mehmet was born premature, and the care we've been receiving here has been amazing. We're really confident when we have the nurse practitioners looking after us. I think it is really great to have someone who's responsible for our son's care, who comes from a nursing background and understands more of the medical side of things and is more responsible for that. There's more of a focus on the whole patient perspective and just making sure the entire experience is as best it can be in maybe a not so great situation having to be in the hospital.
Nurse practitioners are engaged very actively in securing timely access to quality patient care to Ontarians in all sectors and in all communities. They also are tremendously engaged with Aboriginal populations, with elderly persons, with people with mental illnesses and addictions, and also people with chronic health conditions.
As more people become familiar and have contact with a nurse practitioner, we find that we're getting calls daily from communities.
I'm delighted that the nurse practitioners are celebrating 40 years as a profession, and so to have a celebration and a gala is a way, I hope, of making other people and more people in the province recognise the contribution that they make to the well-being of all of us.
It's my pleasure to extend greetings to the Nurse Practitioner Association of Ontario and congratulations on 40 years of tremendous service to your members and to Ontarians.
Congratulations, NPAO, on your 40th anniversary. Proud to be a member.
Happy 40th anniversary, NPAO.
Happy 40th anniversary, NPAO.
Happy 40th anniversary, NPAO.
Happiest 40th anniversary to our magnificent colleagues at NPAO.
I'd just like to extend my warmest congratulations to NPAO. I'm so proud and so honored to have been affiliated with you, and I think it's tremendous the progress that you've made.
Happy anniversary, NPAO!
We've come so far working together. We've now got 25 nurse practitioner-led clinics up and running. You're providing superb care to Ontario patients. Thank you.
Just so happy to be able to wish you the very best for your 40th anniversary.
Congratulations.
Congratulations, NPAO.
Congratulations, NPAO and all nurse practitioners on our achievements over the past 40 years.
Congratulations to the Nurse Practitioner Association for their 40th anniversary. We are very proud of you.
Congratulations!